night, everyone, and welcome to another episode of Wife Her Live. We're so excited to have you on tonight as we discuss men's health. This conversation is going to help you keep some men in your life alive, guaranteed. So, without further ado, I'm going to introduce our guest speaker. We have on tonight a registered nurse and educator, and I'm so excited to welcome her to the platform. So, Mrs. Charlynda Cartwright is a wife, mother, educator, and student. She attained a Bachelor of Science in Nursing from the College of the Bahamas, now the University of the Bahamas. Since graduating, she has worked as a registered nurse in public and private sectors, inclusive of community clinics, schools, both hospitals in the Bahamas, and in home care nursing in New Providence and the Family Islands. After 5 years of practicing as a nurse, she pursued a Master of Science in Advanced Nursing Education at UWI School of Nursing in Kingston, Jamaica, and graduated in 2019. She is currently a nurse educator at Doctors Hospital, the Institute of Learning, and an adjunct faculty at the University of the Bahamas School of Nursing and Allied Health Professionals. Talk about full circle. Y'all clap for her in the comments tonight. Additionally, she serves as an instructor under the American Heart Association, for which she is certified to facilitate the Heartsaver FirstAid CPR AED course, which is where I first encountered Nurse Cartwright. Basic life support course, advanced cardiac life supports, and pediatric advanced life support course. Committed to personal and professional growth, Charlynda is also currently pursuing a PhD in education. I don't see those comments going. I need to see those comments going for our guest tonight. PhD in education, learning, instruction, and innovation at Walden University. In addition to these many hats, her most enjoyable ones to wear are the wife to Mr. Don Cartwright. Hey, Don, if you're watching, and the mother of their pride and joy, their 20-month-year-old daughter. Did I say 20-month-year-old? 20-month-old daughter, Miss Mackenzie Danny Lynn Cartwright. So without further ado, I'm going to welcome our guest speaker onto the stage. Good night.
Good evening, everyone.
Before we jump in, I just have to share that story quick about when I touched down in Nassau for the holidays. I don't know which holiday it was. And I had on my mind, I wanted to do this conversation. It was last year, it was last year, actually. We're in 2022. And I said, I saw you in the parking lot at Harbor Bay, and I ran you down, and I was like, you crossed my mind for this conversation. And here we are, so many months later. Yeah. Information is no less important today as it would have been then. So without further ado, I'm going to pull up your presentation, and we'll get right into it.
Okay, so we're going to get started talking about keeping him healthy, what women should know about men's health. So our agenda tonight is to talk about common illnesses affecting men's health, preventative measures, and healthy lifestyle changes. So let's go into those common illnesses affecting men's health. We will discuss tonight heart disease and stroke, prostate and colorectal cancer, diabetes and hypertension, poor diet and sedentary lifestyle, and obesity. So, heart disease. What is heart disease? Heart disease is the leading cause of death in women and men in the United States. However, men die from heart disease more than any other illness in the United States. And that is from the CDC actually this year. So let's look at some of these risk factors of heart disease so that we can have a better understanding of what causes it. We have hypertension, which is very common in our arena, in our country, in our Bahamian men. Smoking, high cholesterol, and unfortunately, just being Black is one of the factors that put you at risk for having heart disease. Obesity, if you have a family history of cardiovascular disease or heart disease, and if you are inactive or lack of exercise. All of these put you at a greater risk to develop heart disease. So there are four types of heart disease. They are coronary artery disease, arrhythmias, which are heart rhythm disturbances, heart valve, heart valve disease, and heart failure. So here in this photo, I have a picture of what really happens in coronary artery disease. This is one of the diseases that we're going to talk about a lot, and you'll see that it keeps coming up because all of the risk factors they come full circle. So you would be at high risk to getting a lot of these same illnesses by doing the same things. So this picture shows you a normal, you can go back, Stemming, a normal artery, a normal coronary artery. So your arteries pump blood, your heart pumps blood through your arteries around the body, right? And here you have a narrowing of the coronary artery. Your coronary arteries supply blood specifically to your heart. So just as how you have arteries and veins that supply blood to everywhere else around your body, your coronary arteries are more, I wouldn't say more, but they are very, very important because they supply blood to the one organ that supplies blood everywhere else. So we do not want those to clog, right? So here we have a picture you can see of an abnormal blood flow caused by plaque. Plaque is that this substance you can see in the artery, making it more narrow, and that is normally caused by that same sedentary lifestyle that we talked about, all those risk factors, high cholesterol, smoking, obesity, all of that causes that narrowing of that artery. Okay, we can move on. So what happens after that artery becomes more narrow? It can cause strokes. Stroke is another major medical emergency that can affect our men. They have that same sedentary lifestyle and hypertension and the like. They are at risk for getting a stroke. So, strokes are the best way to describe it is there is a cessation or you have blood supply that stops, right? You need blood to go to your brain, to everywhere in your body for you to survive. However, if there's a blockage, then the blood won't be able to flow to that place. Anywhere that blood doesn't flow dies. So the important part about stroke is to try and get that blockage removed so that the person can resume normal functioning. Our next slide will show you some of the things that you might see if someone is having a stroke. So if you was to see any one of these things, actually if you see at least three, the person is definitely having a stroke, right? So what you would see if you have, if someone is having a stroke is what we call fast. You want to ascertain these things. Does the person have a facial droop? Does one side of the face droop? Or one way you can determine that is to ask them to smile. Once they smile, if you don't see the face symmetrically smiling, one is slanted or drooping, that's definitely a facial droop and it's a sign of a stroke. Next, you have arm weakness or arm drift. You can ask them to hold their arms. If one drifts, then that's a sign of stroke. And the last one is speech. Ask them to say a phrase, or you can ask them, what is your name? What is today's date? Repeat. You can't teach your old dog new tricks, and they will have difficulty speaking. If you see the three of these, then it's time to call 911 because we want to get this person to an emergency room right away so that they can get treatment to relieve that blockage that caused by either plaque that we saw in the arteries or a clot that is blocking blood flow to the brain, because that is essentially what a stroke is. So, how can you help with heart disease as wives? You can ensure that he eats a well balanced diet, including fruits and vegetables. There's nothing new that we haven't heard before, right? Quit smoking, exercise regularly, cut down on alcohol, maintain a low cholesterol, reduce stress, and take medications as prescribed. Get regular checkups. And you know that men don't like to go to get to the physician to get no checkup, right? I fight with my husband all the time. I win, but I fight with him to go and get a checkup. But regular checkups are important. Let's look at some what a balanced diet would include, because it's very important. So we want to have low levels of saturated fats, right? And that can be found in meat, lard, cream, cakes, biscuits. You want to try to include healthier sources of fat such as fish oils, nuts, seeds, olive oils, right? Instead of buying corn oil, buy olive oil. That's one of the ways that you could help your husband and his balanced diet. Monitor your consumption of fried foods, conch and crawfish, what we love to eat so much. All of that causes an increase in your cholesterol. You also want to monitor the level of salt. You want to aim for less than a teaspoon a day. Be mindful of the foods that already contain sodium, like your processed foods that'll be anything in a bag or a can. They are full of salt. Avoid drinking Gatorade. Gatorade is a big, big no no. It is not a soft drink. It should be used only or consumed only after vigorous exercise or sweating, and if you have vomiting or diarrhea. Other than that, do not drink it. It has too much sodium, too much salt in it. Only thing you're doing is helping yourself to get hypertension later on. So no, no Gatorade, right? Next, we have low levels of sugar. Sugar is in everything, right? And we love sugar as our cakes and all the sweets. And sugar can be found in fruits, it's in our carbs. Our body breaks down carbohydrates into sugar. So if it's already breaking that down into sugar so that we can use that as energy, imagine adding additional sugar like candies or chocolates. You should have those in moderation. You want to increase fiber and whole grain foods, because fiber is very important, and we're going to talk about that later on as we talk about cancer. We want to eat fruits and vegetables, at least 5 portions of fruits and vegetables every day. And I just want to share this little nugget. Recently, my husband decided that we're going to have some more fruits and vegetables. So he went out and he bought a juicer. And now I think I'm drinking more of the juice than he is. It's so good. He got all kind of fruits and vegetables, and so for breakfast I had spinach, kale, melon, and carrot, and it was so good. It actually last kept me full for about 4 hours, which is a good thing. So if you don't want to chew the salad, then one way you can do is by blending to make a smoothie or buy a juicer. So let's talk about prostate cancer. So, prostate cancer risk factors. It affects men age 50 or older who has an ethnic background, again, of African or Caribbean. So, again, you're at risk for getting prostate cancer just because you are Black. Family history. If you have a family history of prostate cancer, meaning that your father or one of your brothers or uncles had it, then you have a family history of um, prostate cancer, and that puts you at a higher risk, or your husband at a higher risk. If they are obesity, If they have a diet that's rich in calcium, and of course, smoking makes everything worse. So, smoking also puts you at risk for prostate cancer. So, let's look at some of the signs and symptoms. What will we see if our husband is experiencing symptoms of prostate cancer? They would first have difficulty with urination. So I want you, if you can see clearly, look at the picture on the slide. It tells you where the prostate is. So at the top is where the bladder is. And as it comes down, this pink structure that you see is the actual prostate gland. And so urine has to leave the bladder and pass through the prostate gland to get to the urethra for a male to urinate. So in prostate cancer, the cells, well, in all cancer, cells just continue to grow. But in the prostate cancer, cells of the prostate continue to grow. And so that's why you see it looks distorted here. It looks bigger than it would in the normal prostate. So that causes a weak or interrupted flow of urine because it's not going to freely pass if it's swollen, right? Or if it's too big. They're going to have frequent urination, especially at night, and difficulty entering that bladder. And if you look, you can see it why they would have difficulty emptying the bladder. So they'll always feel like their bladder is full, or they always have the urge to urinate because they cannot get the bladder empty because you have that swelling there. So that's what you would look for. You see them keep getting up in the middle of the night to pee? That may be a sign. Another sign would be pain or burning during urination and blood in the urine or semen. So that's something you want to look for as well. Let's talk about this screening of prostate. So men, like we talked about earlier, does not like to go to get a checkup, period, right? And I know there are a lot of jokes about being probed, and they don't want that. They don't like the idea of a physician doing this prostate screening, but it's one of the tools that help to diagnose um, prostate cancer. So this is called a digital rectal exam. That's what you're looking at on the screen, and the test examines the person's lower rectum, pelvis, and pelvic region. The test can detect cancer and other issues in men, but is also used to detect ovarian cancer and uterine cancer in women. Another type of screening, however, is what we call a prostate specific antigen test, and or PSA. This PSA is a protein made by the cells of the prostate gland, and the cells, they are mostly found in the semen, but they also have the same PSA can be found in blood. So it's actually just a blood test. So it's not the only screening, the digital exam that most men are uncomfortable with. You can now tell your husband that's not the only way that they can determine if you're healthy. You can just get a blood test. So you would get the blood test, and the levels is normally under 4 nanometers of mercury in the blood. And when the prostate, if prostate cancer is there, more than likely it's above 4. So that's something you could look out for. However, about 15% of men who have a PSA below 4 can still have prostate cancer, but there's another test that they would do to rule it out, which will be a biopsy, right? That's a minor procedure where they would get the prostate, minor procedure where they'll take a tiny tissue sample of the prostate to actually confirm whether it's cancer or not. But this blood test can actually tell you if something is wrong or not, so that you would know to do further tests, right? We want to catch it early before you have any issues. And let's look at this age, because there's a certain time when you should do it. Mostly it's men who are 50 and older. And for the PSA, 40 to 54 if you are at high risk. Again, that's if you have men in your family with or who have been diagnosed with prostate cancer. That's like your brother, your uncle, your grandfather. That's a family history. So you would probably need to do a PSA, get the blood test done around 40. And if not, then 55 years old is fine for you to do the blood test at that point. Let's talk about colorectal cancer. So that's prostate cancer. Now we're going to talk about the colorectal cancer. And here's where eating fiber and drinking water comes in. Okay, so here are some of the risk factors of colon cancer. We have hypertension. You see it comes back again. Smoking, alcohol, high cholesterol, a person who has had a family history of colorectal cancer or polyps, a low fiber, high fat diet. So that means all you eating is your fried foods. They come to haunt you later. Diabetes, age 50 or older, inactivity or lack of exercise, and again, being black. So I don't think we could change our color. So the next best thing we could do is try to control those other risk factors, right? We could exercise, we can control our cholesterol, and ensure that he gets a high fiber diet. So let's look at some of the signs and symptoms of colon cancer. So someone would have a persistent change in their bowel movements, rectal bleeding or blood in the stool, persistent abdominal discomfort, and feeling that the bowel doesn't empty completely, weakness or fatigue, and unexplained weight loss. Okay. So when we talk about the bowel habits, changes in the bowel habits, that's talking about if they just have diarrhea or constipation, and that's not normally what would happen. So that's a change in your bowel movements or your bowel habits. If you know that your husband normally goes to have a bowel movement every day, and then you see it's been 3 days, 5 days, a week, that's a change in bowel habits. Okay, so that's something we would look for. Then we have persistent abdominal discomfort. That's like cramps or pain or gas in the abdomen. So that's something else you would look out for, the combination of those two. So that's why it's just always important to just go and see your physician, right? So let's talk about the continued colon cancer screening. So how do we determine after you don't go to the doctor that whether it's colon cancer or not? So there are several ways. There's a test called fecal occult blood, and that we normally do that test at 45 years old. High risk or increased risk for colorectal cancer, patients should do a colonoscopy at age 45. Also, you can do a computer tomography or CT scan can be done to detect colorectal cancer. So that's just going in the scan, right? So that's it for colon cancer. We'll be moving on to diabetes and hypertension. So this is basically the last illness that common illnesses that we would see. And these two are very common in the Bahamas, right? So diabetes. Diabetes is a condition in which the body produces non or insufficient insulin. While anyone can develop this condition, it produces several symptoms that are unique to men. So in diabetes in men, it causes erectile dysfunction, genital thrush. So genital thrush in a female and in a male will present differently. Genital thrush, or you might hear in our society people call it trash. The baby has trash on their tongue. It's thrush, right? That'll be oral thrush, which is a yeast infection. So genital thrush in a female will be a yeast infection, and in a male you might see like white spots on the head of the penis. Same thing, right? Reduced muscle mass, weight gain or weight loss, frequent urination infections, frequent urination, excessive thirst, and excessive hunger. So those last three are like the hallmark signs. You'll see that in women and in men. Frequent urination and excessive thirst and hunger, and that genital thrush is very common in someone who has hyperglycemia and they do not know. Let's look at the risk factors for diabetes mellitus. Again, hypertension, age. As you get older, you have a higher risk for getting diabetes mellitus. High cholesterol, family history of diabetes, being black, again, inactivity, or lack of exercise. All of that are risk factors that can cause you to be diagnosed with diabetes in life. Hypertension. Hypertension is a disease or condition in which the long-term force of blood against your artery walls is high enough that it may eventually cause health problems such as heart disease. So here I have a picture of what's really happening in the artery. So we're back at the arteries again, and the same plaque is there as well. So let's think about this. We imagine a hose. We have a hose, and we turn on the water, and water is flowing through the hose freely. So that's your normal blood pressure, right? Then eventually we start to have this built up. So something in the hose is causing a blockage. If you think about it, if you have something causing a blockage and the same amount of pressure is trying to get through a more narrow hole, it will increase the amount of pressure that's in that artery or in that hose. And so you will have of a force trying to get out of this smaller hole. And what normally happens because of this force, you're going to break off some of this plaque because it can break off. This is like fat that got hard in your arteries. That's essentially what it is. Fat built up and it got hard and now it's in your arteries. And with that force of blood pressure, it can break off that plaque, and that plaque starts floating around your body, goes to the heart, can cause a heart attack, goes to the brain, can cause a stroke, goes to the lungs, can cause pulmonary embolism, and then all of that can lead to death. So hypertension, which is very, very common, I'm sure all of us know someone with hypertension and may have spouses with the disease or even our parents. And so this is a good illustration of what is actually happening and how it's related to the other chronic chronic diseases like diabetes and heart disease. So let's look at some of the risk factors for hypertension. Smoking and excessive alcohol, high cholesterol, being black again, obesity, personal personal history and family history of hypertension, consuming too much salt and not enough potassium, your age until age 65, hypertension is more common among men. So this is actually one that is not only our black men have two strikes against them just because they're male and because they're black. They are at higher risk for hypertension. So ladies, we have to work on all the other things, ensuring that that cholesterol is normal, that they are active and avoid stress and the like, right? Let's look at how we can prevent and control obesity. So that's diet. Let's start with diet. Cooking at home, not eating processed foods. So that's those processed foods are your fast foods, right? That's how they get to make it so fast because they are processed. They're halfway cooked and then they just warm it up and give it to you and then nice and quick, right? So and those foods, in order to preserve them, they use salt. So most processed foods are high in salt because that's the salt helps to preserve or keep it fresh. It keeps it from spoiling. Low carbohydrates, 9 breads, rice, or potatoes. Low fat and high fiber diet, like we talked about earlier. Low fat, high fiber. The other day my husband and I was in the food store and he wanted to pick up this certain bread and I was like, no, this bread is no good. Bread should have at least 3 grams of fiber in it. If you don't see 3 grams, then don't buy it, right? Um, that fiber helps to keep that colon and colorectal cancer away, as well as the constipation and all of the straining, right? We want to exercise for 45 to at least 60 minutes 3 times a week. Drink lots of water, minimal to no concentrated juices. Natural juices are encouraged. So good job, Dawn, for getting us to do our juicing, right? And attend regular doctor visits. If you are on medications, take them daily. We have, in my experience working in the clinic, which is where primary health care is normally done, patients would always come in and I would always wonder, why are you coming here again if you're never going to take the medication and you're not going to eat right and exercise, because we only telling you the same thing, we giving you the same thing. And so they come get their emergency treatment because the blood pressure or their sugar is so high. And sometimes those stories don't end well. I've had patients before 30 years old who is now incontinent. And what that means is that that patient cannot hold urine or feces because he had a stroke at 31. So now that's his quality of life because he didn't want to take his medication or take these things seriously. He was hypertensive, by the way, and he didn't want to take his hypertensive medication. So that's just one reason to take the medication. And Bahamians don't like medications. I know they prefer more bush medications, and I have nothing against bush, but when you're on bush medication, no one is managing you. When you are on medication, you come to the doctor every 3 to 6 months and you get your blood test done and they check to see your kidney function, your liver function. They're seeing how your body is doing with this hypertension and on the medication. If you're doing better, they decrease the dose. If you're doing worse, they increase the dose. So it's very important to take your medication and see your physician regularly. And that's it. That's my references. So on the next slide, Demi. And that is it. And I thank you. And if you have any questions, I'm open to answering them. Thank you for listening.
Thank you so much for the great presentation. I learned a lot. I shouted at my husband just now, like, Gatorade, you heard what she said about Gatorade? So definitely going to be removing some of the Gatorade from the house with that high sodium content. That was a great, great, great tip. I'll just make us a little bigger for everyone. And so, as I was thinking, I just want to shout out. Well, he's deceased now, but to his loved ones, I keep thinking about my uncle Kevin, who passed away a few years ago. Similar, story with the medications, and just a part of why I'm so passionate about this topic is watching his decline, and it was so preventable, right? And so, like as the women in our men's lives, we have a part to play. Like your decision to tell someone take bush medicine versus that medication could be the difference between life and death. And so, make sure that you are informed as a loved one so that you help to keep the loved ones you love alive, right? So let's talk a little bit about dialysis, and if we have like a relative on dialysis, like how should we monitor them and encourage them in that process?
Dialysis is a very trying, well, not just dialysis, but kidney disease completely. I have a colleague and friend of mine. Her husband actually was diagnosed with kidney failure maybe a year after they got married. Young couple.
Wow.
Yes. So I've heard about her story and her has struggled to get through with both of them actually. And to be honest, what is really crazy about it is that the amount of time that you have to spend on that machine.
Mm.
So it's about four hours a day,
Really?
every
Wow.
other year, or maybe
Every
three
day,
times a week.
3 times a week. Wow.
Maybe it depends on how much you need or how well they would do that
Your kidney.
progress. So as
Mhm.
a family member to someone who has kidney failure, the I would say be supportive and encourage them to continue to do their treatments because they cannot survive without it, right? So that
Yeah.
entailed them waking up really early to go and get his treatments and then still having a full life, a child, a wife, work, you know.
Mm-hmm.
But
Mm-hmm.
I'm happy to say that he got a kidney transplant.
Oh,
I know,
yay.
right? Yay!
Life
So
change.
things has gotten a lot better for them. So they are now looking forward to a new lease on life. So it's not your life isn't over, but support is definitely needed.
Mm-hmm.
Definitely.
We have a question here. How do we encourage the men in our lives to take their health seriously without being a nag? It's a big one. I am so fortunate with my father and even my husband's father. They are on their health. My dad, does his screenings. I don't have to chase him. Ian's dad does all of the screenings for him and his wife. He is the one saying, take your medication. He's the one
Wow.
saying, you have your eye drops. So very, very blessed in that area. And I love to talk to him one day to say, like, how did you get to that point?
I
But
want
I
to know.
know traditionally men don't like to go to the doctor and they don't like to hear anything about their health. They just like to coast. So I know you experience that in your home as well. So what can we do to encourage them without
Without being a
nagging
nag. Okay, so what I
that part?
did right after we got married and I realized that he hadn't had a checkup in a while, I just made the appointment.
Mm-hmm.
He didn't know really where he was going. So I don't want to be a nag. I don't want to talk about it that much. So we
Mm-hmm.
going
I
out. We went.
like
We're
some of
both
us so
out.
busy, to go and be an assistant when I needed assistant. It's difficult. But I mean that's a part of our job, I guess, to be help meet. So ladies, schedule the appointment.
Schedule the
Schedule.
appointment. And sometimes it involves you making sure he gets the day off. So I
Yeah.
at one point I called his boss and say, Don is going to take a day off this day. He doesn't know, but this is why. And so he thinks he's going to work, but he's not. You have the
Yes.
day off, and this is where we're going. Just sit in this chair, let them draw your blood now. But it worked.
Yeah.
He complied, and we found out some stuff that we really needed to know,
Mm-hmm.
and
Mm-hmm.
stuff that we could reverse. You
Yeah.
know.
Mm-hmm.
So oh man,
I find too sometimes men get checkups and they aren't as detailed as when women go and we get our annuals, right? So what should we be scheduling, or what should we be asking for our men? Like, oh, I just want my husband to get a checkup, or is there a special type of wording we use?
no, that's fine. Annual checkup. So the physicians would order all of the annual blood tests that they would normally
Mm-hmm.
do. If you have a specific concern, that would be a good time to say, well, I'm worried about this. I'm worried about that. Then they'll make it more specific. But other than
Mm-hmm.
that, they'll run the regular blood test that they would run for the women as well. Okay. I
Okay.
mean, we have our extra stuff to deal with our reproductive health, but for them, they'll make
Mm-hmm.
sure because these illnesses that we discussed tonight, they are aware of them.
Yeah.
So they'll be checking the blood pressure, and if they see elevation, then they'll be okay. You need to come back on this date or not, right? Or when to come back, and they'll follow them up. And so it's just gonna be on you to be like, okay, don't forget you have to go here. Okay, remember, because you'll be saying that forever, and no, we
Yes.
never had that conversation, right?
And
Yeah,
from the mouth down, ladies, like even dental appointments play
yeah,
a big role in a man's health. The bacteria in his mouth, the plaque in his mouth, like even that could lead to things even further down in the body, like the heart. And I remember at my doctor's office, they have the mouth open and they show you all of the different illnesses that are actually linked to the mouth. So even don't skimp on the dentist appointment, even schedule that one as well,
I did do
top
too.
down. But let's talk a little bit about supplements because I know our men don't, like you said, they don't like medicine. They like bush medicine. And I also see this big push to supplements to, for erectile function and all of these different things to go long and strong. Let's put it that way.
Yes,
And, I don't know if, people understand everything that they're taking. So as women, like, should we be more open to or just aware of like all of the supplements a man is taking? Should we, take them to the doctor with him to make sure that these are clear? Like, what should we be doing in that area?
definitely, definitely. And I don't really trust those long and strong medications. You won't never know, especially those ones that don't be in English. You seen them?
Yeah.
But
Mm-hmm.
they taking them. Then even in English, they don't know what they're taking, but
Mm-hmm.
they take them because of what they want to happen, right? Definitely, with the supplements, you would want to find out exactly what is in them. And for regular daily supplements, when I take my vitamins, if we eat breakfast together, right as I put mine in my mouth, and he'll be looking at me like this because he know I coming over to say, here, take this too, this for you. You swallow that
Oh
because he
yeah.
doesn't want to. He doesn't want to take them, but I know that they're good for him, and that one of the things that I encourage him to take would be the fish oil
Mm-hmm.
because that's one of the good. That's a good supplement for everyone for heart health, right?
Mm-hmm.
Fish oil. So
In our
yes,
house, it's the gummies. So I'm saying, hey, did you take your gummies today? Bring him his gummies, his one a day gummies, and a glass of water. But it's so true that we have to take some level of accountability when you bring and that's a part of what marriage is. It's like a different level of accountability, right? I can't just say, oh, I take my vitamin I good today, like I took mine. You have to have that level of accountability to make sure they're good too. Like, you doing your physical, let's talk about you too. So it's a little different because you're balancing caring for them but also not wanting them to feel like you're a parent. So
yes,
some men, if you go ahead and you schedule everything or you have everything running the show like that, they may feel as if like you're taking away my autonomy.
that's
Not every man views that as helpful, so it's a balance there as well. And you have to know who it is that you're dealing with, and
that's the
hopefully it's vice
yeah.
versa.
You have to know your husband.
Hmm.
I was able to do things like that because I know that if I don't, it's not gonna happen, and he knows that too. And
Hmm.
so he allows me to to do that in that way because I would ask and I'll give him space to get it done on his own. But let's be real, it ain't gonna happen.
And it's
No.
it's a way that you love. He knows your profession. He knows that
Yeah.
this is you showing him that you love him. And so, hopefully that other men as well. I know we have some other on that he will see it as you expressing your love to him. And so I don't have any further questions. I don't know if you want to leave us with parting comments, where we can find you. I'd love to bring you back next month when we talk about women's health and all of that, all of that, all of that, all of that. Right? So let us, let people know where they can reach you across social media to stay
Okay.
in touch.
So on and I just use my name a lot on
You know what?
Instagram. I just use
Oh,
my name. Nothing
okay.
fancy. On Facebook, I'm Charlynda Cartwright. On LinkedIn, I'm Charlynda Cartwright. On Instagram, I'm Charlynda C. And on Twitter, I'm Charlynda M. So you can feel free to reach me on any of those social media platforms. If you have questions you want to ask about anything that we discuss here today, I'll be more than happy to share them with you. I also have a blog, can't remember the name of it right now, but I can
I will put
say,
it
okay,
uh,
thank you very much.
all of these details as well as the blog in the description. And we just want to thank you so much for imparting your wisdom tonight. I know you saved some lives, and if not in the next 5 years, in the next 10 or 20 years, people will be saying, my husband is alive today because of what I learned from you today. So we thank you for that and have a blessed night.
Thank you. Thank you for
Bye,
having me.
everyone.
Bye.